Thank you very much, and good morning, everybody. And thank you to the organising committee for inviting me to this, I think, really very important, really critical meeting. And I was just reflecting on what the Minister and the distinguished oncologist here have been saying. And actually, I think that we at MSD are very much aligned with many of the sentiments that we've heard here. And I really have three reflections that I would like to make over the next 5 or 6 minutes. So the first thing that I would like to reflect on is the great progress that has been made over the last 20 years. It was interesting, the Minister was talking about the general public or general population not wanting to even mention cancer. So the country I'm from, the United Kingdom, people used to talk about the big C, but they wouldn't say the word cancer. That's changing. There's a lot more openness to discuss cancer. There's a lot more, I think the stigma, although it's not totally removed, I think the stigma is actually being reduced around cancer diagnosis, which is really very good. I think we have made great progress. We're seeing mortality rates are dropping across many cancers. I think some of you may have seen that the American Cancer Society recently published their annual survey of mortality rates, and across almost all of the most common cancers we are seeing in general: lung cancer, colorectal cancer, breast cancer. There was possibly a slight increase in the US for mortality over the last year, but in general we're seeing mortality is improving. And we've seen a lot of technology, and we've already heard from the previous discussants about how technology is making a real difference, whether it's immuno-oncology drugs, whether it's targeted drugs, better earlier diagnosis, screening, the use of biomarkers. All of these things, I think, are contributing to the great progress that we're making. And if I may mention one or two specific cancer types where we've seen real progress, I'll give you an example of melanoma. 10 or 15 years ago, melanoma was a disease with metastatic melanoma, unfortunately, the majority of patients were not really surviving beyond 12 months. And we're now seeing really prolonged survival with some of these newer treatments. We're seeing survival which is perhaps 10 times longer than what we've seen before. The same is true for non-small cell lung cancer. Again, the average overall survival for non-small cell lung cancer in the past had been less than 12 months. And we're now seeing that for patients who were diagnosed between 2016 and 2018, 1/3 of those patients are living more than 5 years. We've seen the impact of prevention through vaccination, through HPV vaccination, and the impact on cervical cancer. These are all, I think, examples which give us a great deal of hope. Having said that, we do appreciate that we still can and absolutely must do more. We have an aging population. We are seeing increased rates of cancer globally. It remains a huge health challenge and a huge burden that all the stakeholders, we need to work together to improve that. We are also seeing some concerning trends around increasing rates of cancer in younger patients as well. We should acknowledge that. For example, cervical cancer, we have seen that over in the patients who are 30 to 44 years, over the last 10 years, we've seen an approximately almost 2% increase in the rate of cervical cancer being recorded. So we have to be careful there as well. And there is a great deal that needs to be done for prevention. Probably around half of cancers are preventable. Risk factors of obesity, of smoking, of alcohol. There is a great deal that can be done through public health initiatives. And I know there's work here in Greece on smoking, reducing the rates of smoking, for example, which I think is absolutely critical. And at the same time, screening is essential. And I know also Greece is now really getting much more involved in screening with breast cancer, colorectal, cervical, and I believe also being part of the European pilot to look at lung cancer screening. We know that earlier detection gives better outcomes, more chance to be treated in early stage, more opportunity to have a prolonged remission. So my third reflection is really about, I feel the momentum here. I feel the momentum from the statements that I've heard from the rest of the panel here. I feel a momentum and a real drive and a real willingness to continue to tackle cancer. I think as we have improvements in treatment, new modalities, new biomarkers. I think that will really bring us into an era of our ambition, which is to turn cancer from being a fatal disease to being a disease which becomes a chronic disease that patients live with. And one other point before I close is quality of care. I was very happy to hear you mention quality of care. It's something that we in MSD are very committed to thinking about the whole treatment experience, to have a holistic approach and not just think, of course, we're very much thinking about our phase 3 program and about our outcomes and about registration and about discussions with payers, but we have to think about the whole patient. And I think patients will really demand to have this kind of quality of care approach, quality of life, and looking at the whole treatment rather than just focusing on a more narrow efficacy view. So just in closing, for my 3 reflections, I wanted to say we at MSD are very interested in policy. We're very interested in working with national governments. We're very interested in working with leading oncology associations. We're excited about the Greek National Cancer Plan. We want to be part of that discussion. That's something that we feel very much committed to. So I really would like, again, to thank the organisers for this opportunity, just to give some reflections from an MSD perspective, and to say that we feel that we're part of the overall stakeholders that should play a real role in having great impact on the lives of patients with cancer.